please go to our QUAMED Learning. We go to our QUAMED Learning site, of which you see the address, and have a look for yourself what we are talking about. Just a few words about QUAMED as an organization. As you may know, we're a not-for-profit association working on improving access to quality medicines for everyone and everywhere. We were formed under the auspices of the Institute of Tropical Medicine with funding of the Belgian government. And we're based in Belgium, as said. We're a membership organization. We're now around 75 members, individuals, as well as procurement centers and NGOs, all around the focus of quality of medical products delivered in low and middle income countries. So QUAMED Learning, the focus of our webinar this afternoon. Angelo, next slide. QUAMED Learning is in fact a site which is composed of three main elements. We have the learning part, where we present the e-learning courses for the professionals. We will have embedded forums and a community of practice where we can have peer-to-peer learning, and we will have a help desk. So those are the three main elements of the QUAMED Learning system, the digital learning system. And I would like to indicate that over the past 2 years, that when we developed it, we had a lot of support. All the financial support, in fact, came from the Bureau of Humanitarian Affairs of USAID. So why did we, in fact, develop this QUAMED Learning platform? Next slide, please. And for whom did we develop this learning platform? So we have quite a bit of experience in doing assessments, technical visits, and audits of manufacturers, wholesalers, distributors in the private and public sector. And very often, when wholesalers or distributors weren't able to fully comply with the WHO, GSDP, or MQES standards, they would ask us to come and help them to offer technical assistance. However, you cannot be judge and jury. So we said, as auditors, as assessors, we cannot also give you customized advice on how to comply with these standards. And then they said, please refer us to a training, because we want to invest in becoming better, becoming more compliant. We looked around and we found very little, especially in the terms of MQES, but also in terms of GSDP. There are training courses in the European Union, in the US. They're often expensive. They're only in English. They are facilitated. It's difficult. So we thought, hey, there is an opportunity to assist manufacturers, wholesalers, distributors, and others in low and middle income countries by developing a course that lowers the thresholds for them to participate. So that is one of the main focus groups for our QUAMED Learning. Next slide, please. In addition, of course, there's also staff from UN agencies, NGOs, faith-based networks, and others. So it is all the distributors, wholesalers, manufacturers, and others involved in the supply of medical products, as well as organizations working in our humanitarian and development sector. So, without further ado, I would like to introduce the first speaker, which is Jason Bauer. Jason is a member of QUAMED. He also manages projects for us within in QUAMED. He has been working in quality assurance and PSM management for more than 13 years now. And in the context of the low and middle income countries, he is from Australia. He is a pharmacist. And he works quite a bit with us on various aspects. And he will talk more about the content of our e-learning courses. Jason, over to you.
Thanks so much, Ed. Great. Hi, everyone, and thanks for joining us. So to introduce, there are currently 2 e-learning courses that are currently live on QUAMED Learning. And those are the 2 on the left, being implementing the WHO GSDP, or Good Storage and Distribution Practices guidelines, and the Model Quality Assurance System for Procurement Agencies guidelines, the MQAS guidelines. So the two courses are the GSDP core option and an extended version of that course, which is the extended option. So those are both live on the platform at the moment. And in the coming month or two, we'll also have on the platform available the third course, which is on conducting GSDP and MQAS inspections. And just to highlight that these courses they're interactive, but they're self-paced. You can do them in your own time. But importantly, they're free. They're free to everyone, as Ed mentioned, and they're publicly available to all who would like to do the courses. Thanks. So I'll go into a bit more detail on each of the courses now. So the first course, as I mentioned, is the implementing the WHO Good Storage and Distribution Practices and Model Quality Assurance System guidelines. And that's the GSDP core option. So this particular course focuses on practical areas which apply in both the guidelines. So the GSDP guidelines are the primary reference for organizations that are involved in procuring, receiving, storing, and distributing medical products. So that's really important for those organizations that we mentioned earlier, like wholesalers, distributors, suppliers, agents, transport, logistics providers, etc. So these organizations are all carrying out those important functions. And the GSDP core option is particularly relevant to those organizations. So it differs, though, from course 2 in that it focuses on particularly the GSDP guidelines, but it also includes what are the requirements for those particular activities in the MQAS guidelines. So that includes the general requirements of both guidelines, quality management systems, receipt and storage of medical products, as well as distribution and transport, etc. So those are the main themes of the GSDP core option. It is 4 modules, and the estimated time that it's likely to take you in terms of level of effort is about 15 hours. And that might be different according to the speed at which you go through it. The second course is an extended version of the first course. So it's also aimed at the similar kind of target audience, but it's particularly relevant to those who are really interested to learn more about how they can better assure the quality of pharmaceutical products in particular, that they actually select and procure. So it's doing some more of that upstream quality assurance according to what is covered in the MQAS guidelines. So it has 2 additional modules that covers those areas, so a total of 6 modules. And those additional modules focus on the pre-qualification of products and suppliers. So choosing good quality products and pre-qualifying those products, as well as the quantification and procurement of those approved products. So that course includes 6 modules, and it's a longer one. It's an estimated time effort of 22 hours. So just to say again that both of those courses are live and available on the platform now. Now, the third course that I mentioned that we're in the process of finalizing and uploading onto the platform, it's on conducting GSDP and MQAS inspections. So this particular course is aimed at professionals who are interested in being auditors or inspectors or carrying out audits or inspections according to the GSDP or MQAS guidelines. So it's going to be a great course as well. It's got 6 modules. It's got more of a focus on what you would be looking for in organizations when you're inspecting or auditing those kinds of organizations, and just general skills that are important in an auditor or an inspector. as well as all of the processes of organizing, carrying out, and following up from all. So this course, again, yeah, six modules, and again, it's interactive, self-paced, and free. And at the end of each of these courses, you will once you've completed all of the modules in each course, the participants will be awarded a certificate of completion, which looks like this one here. And just to a note on accreditation, already we have the course accredited. Both of the courses that are live now are accredited by the Pharmaceutical Society of Kenya for CPD credits in Kenya. But we're also in the process of finalizing arrangements to have the FIP seal of accreditation as more of an international type of accreditation, which will be great. And I think that's it from my side. So I'll hand back to Ed. Thanks, Ed.
Thanks, Jason. Very, very interesting about the contents and very clear. All this could not have been possible, the development of this content of the courses, without our next speaker, Sanjay Saha. He's the founder and CEO of B-Skilled Global. Although we are specialists as an organization in the content, without Sanjay Saha, we would not have been able to put it all on the platform, because he was essential in developing the actual platform and digitizing the e-learning courses. He has been working for more than 15 years, focusing on health systems, specializing in health supply chains, pharmaceutical regulatory, and workforce development. He has worked with a variety of stakeholders in our sector, and some of his achievements include publishing organizational competency framework for EPSS in Ethiopia, working with the Global Fund, and supporting UNRWA. So Sanjay, please enlighten us a little bit about the technical background of QUAMED Learning. Over to you.
Yeah, thank you so much, Ed, and thanks for the kind introduction. When we, as B-Skill, joined this endeavor with QUAMED, the objective was to find a way to host these training programs which were being developed by QUAMED experts in a way where it is a really interactive user interface. The learning system should be very engaging, and also there should be a way for users and learners to ask questions and find various other resources, sometimes related to the e-learning program and sometimes in general as well. So we combined different facets of e-learning together. We brought a social network type of a system to QUAMED Learning, where we ensured that this platform will encourage users to collaborate with each other through a social network type of an design, and also aid in learning beyond just the materials. So in the next 10 minutes, I would like to show you some of the features of this platform, and then very quickly take you through a live demo as well. So as you see, some of you who may have already registered and logged into the platform, there is a very new kind of a user interface, which is similar to platforms like Facebook or LinkedIn, where each user will get their own personal user dashboard, where you will see your course progress, the discussions that you were part of, and you can also see what is happening otherwise in the platform. The platform also has several interactive tutorials and user guides that you can refer to make sure you are fully familiar with the platform. In terms of the learning system, it has two elements embedded into it, where you can see who all are there on the platform, so that you can interact with them and learn about their profiles and also talk to them once you get connected. But in terms of the learning material itself, since it is self-paced, you have full you are able to manage your own progress the way you want. So if you have enrolled into the extended option course, for example, which has 6 modules, so you can pace yourself on how you would spend those 22 hours, whether over a month, whether over 3 months. So you would have full access to the course, based on your own plans. And during the time when you are going through the courses, you can also find out what other users are, how they're interacting with the course, the various forums the courses have, and how they are going through the various activities and exercises. So, for example, if you see on screen, there's a screenshot of a forum discussion which is embedded into the course, and you see that there are 123 responses already. And every passing day, we are getting more responses on these discussions. So if you want to know what is happening in different countries with different professionals, you can also go and read through these discussion forums. Then finally, along with the learning system, there is a help desk, which has 2 components. One component is the knowledge base. So today there are about 70 to 80 resources already uploaded onto the knowledge base, which you can search and read and download. There will be more resources identified and uploaded onto the knowledge base in the upcoming months. Then the second component here is a query system, where if, say, you're looking for something, a technical resource, or you want to ask a technical question which you are not able to find anywhere, then you can create a query through this help desk, which will be received by QUAMED experts, and then they will respond to you based on their professional expertise. Now, however, the feature is live, but we haven't been able to allocate those experts with the help desk, which will most likely happen by the beginning of the new year. So while you may be able to send the queries even today, we may not be able to send you the appropriate response in time. But once this help desk will be live fully, all of you will be informed via email and through QUAMED social network. Now, very quickly, I would stop the slide share, and I will take you directly to the platform and will show you some of the key pages and how to use those pages for your learning. So as you see here, I have logged in as a user. So this is a dummy user. So as you see, for each user, they get a profile page. So you can add details about yourself. You can also add more details about yourself, about a bio, a CV. You can add all these details here. Then if you go on your personal dashboard, the dashboard looks something like this. You have easy links to the overall user guide, the courses, discussions, and the activity page. I can also see that if this is the module I was doing, my progress is this, 94%, and I can directly go and continue this particular module. So far in this module, I have not explored any discussions, so it's not showing here, but if I do, then it will come already here. I can also see what else is happening in the overall community. I can see the various forums, the responses, the activity page, and who are the live members. So for example, I can see right now, Duncan is also on the platform. Then I can also go and see through the members page who are the various members of this site. I can see I can see everyone. For example, right now there are 1,147 members. There's so many members who are online with the green icon. I can also see who are the instructors in this platform. So I can see Jason is an instructor, Zianda, Chantal, they're all instructors, and I can also connect with them and ask questions. So for example, if I need to connect with Jason, I can just click on connect. And then once I'm connected, I can send a message. Okay. So once you connected with a user, you will be able to send a message to them, and they will be able to respond to your queries as well. Then the next thing which I would like to show you is the activity page. So the activity page is like your social media wall, where or social media feed, where everything that happens on the site that comes here, and you can also ask questions as well here. So for example, if I need to ask a question to Jason, so I can also tag Jason directly and I can ask a question. And then once I post this, Jason will also get a notification, just like, for example, I have received a notification here, and then Jason can come here and then provide a response to this as well. Jason, if you are able to see this, if you can provide a response, then we can show it in real time as well. In the meantime, I would also like to show you some of the courses and some of the key points about these courses. So when you come to the course directory, just like Jason mentioned before, there are 2 courses which are currently live, and the third one is in progress. So if I go to one of the courses, it looks like this. When you come to a course for the first time, there is always a tutorial. So you can go through a tutorial to learn more about not this one, sorry. When you first come to a course, there will always be a tutorial. So you will be able to go through the different buttons and how to navigate this particular course. So as you see, this is module 1 of the course. On the left panel, we have navigation. We have materials tab for you to download, and there are some written material and tests. Then each module will have a lot of videos and a lot of interactive materials. So let me show you an interactive material here. Sorry. Let me show you an interactive material here, which also has an embedded video. And this video is directly taken from an international procurement agency. And we have given these videos as practical live examples. And I will shortly invite Jason to talk a bit more about this. But let me quickly play this for you.
Tour of a receiving and quarantine area of the medical product supplier, Action Media in Malawi. As we enter through the receiving bay, we see a desk for preparation and review of documentation and a sign labeling the receiving area. There is good quality racking and pallets available for holding products while they are processed. We zoom into a sign indicating a quarantine zone and a security camera to monitor activities in the area as needed.
So as you saw, these are real videos shot by the warehouse staff at Action Media warehouse in Malawi. And some of these international procurement agents have really helped us to get these real videos and so that we can get this directly to you. The other thing which I would like to also showcase is about these auditor videos where you can learn on what an auditor looks at when they come for an audit of a distributor, wholesaler, or a manufacturer. And these are created through a character animation. So we have created some auditor characters, and they will come at the end of several units and talk about what they like to see during an audit and what kind of non-conformities are there for those functions in a warehouse or in procurement or in distribution. So I will quickly play a bit of a segment here, and then we'll invite Jason to provide us with a bit more of a context on the real videos from the procurement agencies and the auditor videos.
Welcome to the final session of this unit. In this session, you will listen to an auditor
that I look for. The main thing I am trying to determine is whether products in storage are protected from risks that can impact the product quality. As I do a walkthrough, I will observe practice and question staff about their awareness of the key requirements of the GSP guideline.
So as you see, she is one of our auditors, and she's reviewing good storage practices in a warehouse. And there are multiple of these videos with different auditors and different reflections from various audits and inspections. Let me see if Jason has responded to me, and I think he has. So let me look at my notification and then look at Jason's response very quickly. So if you see, I asked a question and then Jason shared me this link of the latest GSDP guidelines. So thank you, Jason. But I would also like to invite you to talk a bit more about these different videos that we have added in the course. So over to you.
Thanks, Sanjay. So yeah, the idea of the actual practical videos, we wanted to. It really helps to understand and improve the learning, I think, by seeing practical examples. And so we worked with some of our partners in some of the international procurement agencies, companies that some of you will be familiar with, I'm sure, just to show real life examples. And they're not always best practice. Sometimes it's not ideal practice, but in general, it's trying to just give you examples to see what works well in some of these areas of GSDP. Yeah, and also I think Sanjay, you were asking about the auditors outlook session. It's really important for suppliers not to do things just because an auditor is going to check them. Your motivation as a supplier really has to be to improve your systems in the interests of quality assurance and improving how you function. But the auditor outlooks are really useful, and we thought it would be good to include those just to give you a bit of a perspective of what are some of the things that an auditor might look for, and it just helps you to make sure that you're checking that you're ensuring that those areas are covered as a supplier or an organization implementing GSDP and MQAS. So thanks, Sanjay.
Yep, thanks, Jason. And I hope you go through the platform and do it, look at it for yourself. There are lots of content. This is just, I would say, the very first time a course on GSDP or MQAS has been designed in this way. So and it's free. So I would really like to see more and more people doing it. And getting their certificate. Now, with this, I would like to hand it back to Ed for introducing the next speaker. Thank you.
Thank you, Sanjay. I think there's one more slide on upcoming features. I don't know whether you want to say something
yeah,
about
sorry.
that.
Yeah. Let me do that very quickly, but you can also cover it later. One of the other things that will come very, very soon on the platform is that we acknowledge that a lot of our users are from Francophone countries, and a lot of our users are from countries who speak Arabic. So the site and the courses will be translated into these two languages very soon. The site is already being translated in French and being tested right now. So you might see the French version already being live under test. But the Arabic version of site will also be available in the upcoming month, and then the courses will be available in the next month or so. Then similarly, there is another feature coming very soon to the platform, which is communities, like professional communities on certain topics like GSDP or good manufacturing practices, and more will be unveiled once these communities are live. So I think this was the end of my section, and I would like to invite Ed back. Thank you.
Thank you, Sanjay. Very, very interesting. So our next speaker is George Mugi, and you heard Jason talking about the auditor's point of view and the auditor's outlook on GSDP and MQAS standards. George is one of our QUAMED validated auditors, so he will talk about the course from an auditor perspective. I think George is a pharmacist, and he has a lifelong experience in pharmaceutical, cosmetics, and household products manufacturing space. He has a strong passion for quality assurance and regulatory compliance within the pharmaceutical supply chain, and then with a focus on manufacturing and distribution. It's like us, he's committed to ensuring quality assured, safe, and affordable medical products and their accessibility, especially to the end user. He has a lot of experience with pharmaceutical manufacturing, quality assurance, GMP, both on PIC, the Pharmaceutical Inspection Scheme, WHO, GMP, and others. And he has conducted multiple GMP, MQES, and GSDP audits in various continents. He holds a Bachelor of Pharmacy degree from the University of Nairobi. He is Kenyan, if I'm not mistaken, George, and he has a Master in Science from Purdue University in the US. And he is a very new member of QUAMED since our annual meeting last June in Brussels. George, the floor is yours. Welcome.
Thank you, Ed, for that introduction. As already mentioned, I work as a QUAMED auditor. And, as we conduct trainings, as we conduct GMP audits, there are some things we see where training like this is required. And of course, as you are aware, I look at it from the three perspectives, from an individual perspective, organizational perspective, as well as the regulatory perspective. And from the regulatory perspective, it's a requirement to comply with the GSDP guidelines. And like in our case, we mainly focus on WHO GSDP guidelines. And why this is important is so that when the organizations are implementing their QMS, they need to base the QMS on the requirement of GSDP. Often we see quality management systems implemented by companies that are compliant to, let's say, ISO 9001. But when you look into the details, they are lacking, they are not integrated with the GSDP requirements. And this is where problems start to arise, because as you all know, ISO is not it's generic. It doesn't take into account what particular activities an organization is carrying out. So you find that elements such as change control, deviation, CAPA, and others are not adequately addressed. And often when we ask, sometimes even some organizations tell us, sorry, those requirements I thought are only applicable to manufacturers. And yet they are ISO 9001 QMS. So there is need for professionals as well as the senior management to understand these requirements so that they are talking from the same page. And of course, training is an important risk mitigation measure to address the risks that are inherent in the distribution of medicines, such as deterioration, counterfeit, and other non-compliances. And as also industry standards are always evolving, so there is need to keep abreast to the training guidelines and technologies, changing guidelines and technologies. So what are the advantages the individuals would have for this sort of training? Of course, individuals would clearly understand the best practices. And as I already mentioned, particularly the professionals who has a responsibility to balance the delicate issue of commercial responsibilities and professional responsibilities. They need to be fully understand clearly the needs for or the requirements of the standard, so that even when they request resources from senior management to implement these standards, there is a clear understanding on the risks involved, the benefits to the organization and to the individuals. And to the organizations, I would say, again, the risk to non-compliance are obvious. There could be risks to the patient, loss of business, many others, reputation issues. So it's very important that all people are aware or they understand their role in maintaining the standards and the compliance as well. And another issue that is important is we see the requirements are not fully used to improve operations, because the standards are supposed to improve operations. That's why, as you understand, for example, proper CAPA processes, handling of complaints, all these are not just meant to, for regulatory compliance. They are meant to improve efficiencies, and we see some of these lacking. For example, when we ask for CAPA process or inspections, and we see only checklist with tick, and then the collection as just a simple response as addressed or implemented or training conducted. It means that process is just being carried out to ensure compliance, whereas supposed to not only ensure compliance but also improve from a business perspective, from an operational perspective. And of course, there is the issue of lowering the chances of recalls or counterfeit or supply chain disruptions. So training is an important mitigation measure, and there is this common understanding that should arise from all the stakeholders as regards the importance of training. And finally, another stakeholder which is very interested in the training, of course, is the regulators, because they only trust that well-trained professionals and professionals that take training seriously are committed to maintaining high standards. And therefore, they are partners in assuring public health and safety. So regulators, of course, will want to see that all personnel, starting from senior management, key personnel, have been appropriately trained. And appropriate training, for example, is not offered in pharmacy school like this for practice, but this course offers a rare opportunity to get skills and knowledge to enable a professional to adequately carry out their responsibilities in ensuring safety and quality of the products. And of course, another interest for the regulators is it reduces their burden on regulatory oversight, because an organization that is well addressing the issue of compliance, taking training seriously, ensuring competence of the personnel, again, reduces the chances of non-compliance and therefore safeguard the end user or the patient. So these are some of the highlights of the needs and the benefits, why we see this course is quite important and addresses a major gap which we observed during the audits. Thank you very much, Ed.
Thank you, George. Thank you, George. It was very, very interesting. all the elements that you mentioned. I picked up on one, which was how to balance the commercial and professional responsibilities, which is not always easy for our friends and colleagues in the private sector. But here there is a means that they can show their manager what is important in terms of quality assurance. So without further ado, I would like to introduce the fourth speaker, which is Colin Shamhuyarira from Zimbabwe. He's a quality assurance and regulatory scientist. I think Colin was one of the first ones to finalize our course and receive a certificate of completion. He's currently working for the USP as a chief of party in Rwanda. He's implementing the USAID-funded PQM Plus program since last year, March 2023. He has experience in many roles related to regulatory standards and WHO standards. And he has worked for years for the Medicines Control Authority of Zimbabwe, whom you all know has just been awarded is it awarded is maybe the right word, maturity level 3 by WHO recently, and I'm sure that Colin has contributed to that voyage of MCAZ. Colin, without further ado, please share with us your experience as a member of the QUAMED Learning platform.
Okay, thank you, Ed. Good morning, good afternoon, and good evening, everybody. I hope you can all hear me well. Okay, so it is my honor basically to speak as part of the user on this extraordinary or one of the most interesting learning platforms, which I personally went through. I think the reason why I was able to quickly complete it because it is easy, very interactive, and also, you know, it kept on giving me the need to continue doing it so that I can complete in time. So I'll give feedback basically on 3 perspectives. The first one is being the learning experience, and the number 2 is being a professional orientation and career development, and third one in terms of the materials that are also used for this training sessions. So yes, Ed MCAZ attained WHO maturity level number 3 recently. It's not offered, it's attained. You have to go through a certain
indeed,
yes, so that you can be, because it is a benchmarking exercise. So you are benchmarked against certain systems, processes, and standards. So you attain that. Thank you. So let me get back straight to my feedback. Basically, number 1, in terms of learning experience, you know, I have gone through a number of professional certification programs, and in most cases, the learning experience is the one that makes things very difficult to actually want to complete a course or to continue doing or whatever you want. But with these QUAMED courses, you know, I think Jason spoke about it, Sanjay, even George, and everybody spoke to it. I cannot ever emphasize about how interactive the system is. It gives you the room, it gives you the power to control what you want to do, how you want to do it, and when. And it also allows you to, you know, to understand the whole systems in a professional manner and in a also learner-friendly environment. So number 1, this is an excellent learning experience, which I enjoyed a lot. Number 2, in terms of professional orientation and career development, personally, I've gone through manufacturing, regulatory international organizations, and also supported a number of pharmaceutical distributors and warehousing companies in my country. This kind of learning courses are grounded a lot in the actual professional needs that needs to be addressed in the actual work settings. It gives you the, you know, the confidence. It gives you the understanding. It also gives you the power, you know, to navigate all the needs, expectations, and also balancing what the manufacturer does and what the regulator wants and what the international they look like, and also you as an individual. So it gives you room for growth. It provides you the balance which you need to provide support or to work in these procurement agencies, or to provide support as a consultant, and even as an owner of a procurement entity. It gives you that balance that you can be able to do it without any challenge. The last one, in terms of material, I'm very happy when Jason was talking about how they managed to get the live material, or the actual material from the actual warehouses, procurement agencies, on what actually is happening in the real world. So the material is balanced. It covers good theoretical grounding and also very practical orientation. It gives you both. So the material is rich enough, to cover everything. Remember, if you go to the dashboard, or to your dashboard, you will find where you can get materials to support your learning. You also find the other part of the material, which is not necessary. We don't take it as material, but when you hear other people giving their feedback, those discussions, those forums, it's also part of material that you can also use, you can utilize as part of your learning. So the material to me is very, very grounding, quite relevant, quite solid, and very, very scientific in everything. So to me, these are the key areas that helped me to get this learning, such that I enjoyed it in the shortest possible time. Yes, I remember quickly doing the first four modules before the fifth module was not ready. And I had to wait for the fifth module to be finalized and to be made alive so that I can continue. So that was the optimism that I got, and that was the motivation. So I can say, in summary, the learning objectives are very straightforward, relevant to the needs of today, relevant to the needs of the industry, and covering both manufacturer, regulator, and even as a business owner. And then the interactive learning process is top notch. And then the professional, career development you get is a good grounding for you to grow further. And then the material will want you to get more and more, so that you can be a properly rounded and a good and a serious and mature professional in supply chain quality assurance of medical products. Thank you. Over to you, Ed.
Thank you very much, Colin, for this ringing endorsement. I understand from you that, and thank you for correcting my remark about MCAZ. I think, like MCAZ, we have worked hard to attain a certain level, and listening to you, I think we have reached the level necessary to satisfy all the stakeholders and partners who want to learn more about the WHO GSDP and MQES standards. I think now, Jason, Sanjay, we're going into the Q&A. I know that I see already some questions in the Q&A session. I'm not entirely sure how you want to do that. I see Sanjay, Jason, would you like to answer a number of the questions already?
Yeah, indeed. Maybe Jason, you can begin. You have highlighted a few more.
Sure.
Than me.
Yeah, I'll go through. So thanks everyone for your questions, and be sure to pop them in there if you've got any more questions. The first one from Mario was, are cold chain logistics as part of immunization supply chain also covered by the courses? And the answer is yes, because cold chain is an important part of good storage and distribution practice. So absolutely it is. It's not like we do give a bit of a special, we do give special attention to cold chain specifically. because it does require special attention, because there are higher risk for temperature excursions and higher risks to the products when those temperature ranges are not met. But it is also just the same as other temperature sensitive products, which include pharmaceuticals. And so in line with the WHO GSDP guidelines, we cover that in the similar way, though, that we would other products that require special handling. So yeah, it's covered. It's not covered in huge detail, not the same amount of detail as you'll get in courses that are specific to immunization supplies, but yes, it is covered. So thanks for your question. Another one, Amanda asked if there are restrictions on the number of people who can do the course, and Sanjay, maybe you can. I think everybody can do the course. There seems to be no limit. We really want as many people as possible to do it. So we're really, we really encourage you to invite all of your staff to do it, who it would be relevant for, and particularly that can be staff that are in, managing stores in your supply chains, or even people in the private sector, and I think. Coming to the question that was from Stephanie about that, I don't say even in the private sector. This course is particularly aimed at people who are operating wholesaler, distributors, suppliers in the private sector, but it equally applies to people in the public sector working in stores and managing supplies, as well as the NGO sectors, as Ed mentioned at the start of the session. So yeah, please encourage everyone to do that. If you're a regulator, if you're working with an NRA in any of these countries, this is a course that you can encourage your all of the suppliers that you visit to do. It's freely available. It's easy to complete, and it really covers all of those critical components of that you should expect those organizations to comply with for good storage and distribution practice in particular. So thanks. And Sanjay, I think there's a couple more that you were going to cover.
Yeah, thanks, Jason. One of the questions which is a few people have asked is they have completed the GSDP core option, and then they also wanted to complete the extended option, but some of the modules are same. So for now, we don't have an option to skip those modules, but we will definitely, and this is a good feedback, we will work on those. We will work on this so that in future, if you have finished core option, then you can just go through the remaining 2 modules in the extended option and get a full certificate that you may want. But ideally, I would say if you have, you are more focused in overall supply chains, then I would encourage everyone to do the extended option, because then you get both the good distribution storage practices, but also focusing a lot on procurement and pre-qualification, which is coming from the MQAS guidelines. So if you cover the 6 modules, which is part of extended option, then you cover core option as well and additional 2 modules for MQAS. But yes, we will try to find a new feature where if you have finished the core option, you should be able to finish the remaining 2 modules and get the other certificate as well. So that was one of the questions. The other question is from Mohammed Farouk. I'm not entirely sure if you're asking about this app or a platform for the requirements of QA for every step of supply chain, whether it is a learning app or you are asking it from a perspective of operations. If it is a perspective of operations, then I guess, Ed, this is a food for thought for you for QUAMED. Maybe you can look at it. But if it is from a learning perspective, then we would really invite you to give us a bit more of a detail on what exactly you are recommending. Share us emails to Ed or Jason or anyone, and then probably they will look at it. The other question, which also came very there is a very good question from Karen. She asked, could this course be used for teaching? I think why not? I think that can be done as well, and we can figure out how to do that. One of the question, I don't know who asked this, but they asked where to download the materials. I would quickly show it again. Give me a second. Yeah, so ideally, not everything is up for download, but there are under various sessions and modules, you will find a materials tab. So if you go into this materials tab under sessions, or even at a module level, for example. So for example, here, it's not here, but let's go to the introduction. So you will see there is a materials tab. So under this materials tab, you will be able to download these materials, and then you can keep it with yourself and you can refer back at a later time. So these materials are either the reference standards based on which this course has been created, or it is the entire course text, the text of the entire course, text and images of the entire course, which you can also download and keep it with yourself. So of course, the text will not have all the interactions and the videos, but you will have access to a detailed textual matter, which you can refer back in future as well. I think I have answered most of it. There are some new questions, so we have about a minute. So I don't know, how would you like to take, Jason, Ed?
Yeah, I'll quickly address a couple, and I think there's also a repository, Sanjay, of materials in the learning platform, right?
Yeah, so that's under the materials tab. So that's what I was trying to show. And then of course in the help desk there is a repository of other materials.
That's what I mean. Yeah, exactly. Great. Yeah, quickly to answer a couple of questions. Ibrahim, you asked about about the potential of using this course for training for inspections. So the third course that's coming out in the next month or two is on inspecting according to GSDP and MQAS, so it's covering exactly this topic. But as well as that, you're very welcome to contact Ed and QUAMED about the potential of doing further training, and particularly on the ground or practical support for training GSDP or MQAS inspectors. So thanks for the question. And Mario, you also asked about distribution to the last mile. These courses follow the WHO guidelines and really cover what's included. And included in those is transport, is distribution from your supplier warehouse to that last mile, and ensuring the quality of products in that distribution. So absolutely, that's covered as well. So thanks.
Thank you, Jason. Thank you, Sanjay. There's one or two more slides. Sanjay, could you just show this is the current situation? We have more than 1,100 members. Out of almost half is doing the courses now, and there's 70 certificates having been issued. I just wanted to add to there was a question about the cold chain logistics. Guys, if you have a request for a training, send them to us. We are starting a new collaboration with USAID. We will have funding to develop new courses, so maybe a specialized course on cold chain management is something that there's a need for. So send us ideas, send us your needs, and we will work on it and add it to the platform. I think this is all the questions we had. There's one more slide, I think, Sanjay. And because I don't want to run over the hour, so we will translate it in French and Arabic, development of more courses, and a number of elements we still have to develop to become fully operational. And I think that is it. If there is anything you want to know, you can ask the questions within the QUAMED Learning platform, or just send a message directly to myself or to Laureen, the technical coordinator. I do want to acknowledge that this course is not just developed by the guys and It's all guys. We don't have any women. Jason, Sanjay, there's a problem.
Oh, there's so many women. What are you saying?
But on the screen now, you and the co-host, the panelists.
Yeah, on the screen, yes. I mean, but yeah, otherwise, yeah, they were not available, unfortunately.
There's a lot. It was a big team that has developed all these courses in the QUAMED Learning. You see them on the screen now, and I want to have a shout out to Chantal Kaitezu Mahoro, who has been brilliant managing this project and this QUAMED Learning. So, looking forward to seeing you all on the platform, and please don't hesitate to get in touch. Wishing you all a very good day. After, of course, and going back to your own work after you have registered, and please register using the QR code. Ladies and gentlemen, dear colleagues, have a very good day, morning, afternoon, evening, wherever you are.
Thanks, everyone.
Thanks, everyone. Thanks
Bye-bye.
to everyone in the